tubing that we have here. So as you could see, the flat part that we were saying that has the little holes, it's fully submerged in the fluid. This is what takes place inside of your body. As your body starts to accumulate fluid, that's when you'll start to notice swelling. I'm going to show you now why it's so important that we maintain these drains and make sure that we always keep them on proper suction. As you could see, you have a belly full of fluid here and you have a bulb that's full of air. There's clearly no movement taking place through this. There's no suction. So this is just starting to build up, and it will continue to build up as your body responds to the trauma from the tummy tuck. So what we're going to need to do is uncap here, as Gloria showed you in the last video. Now we have it on suction. We're removing the air, and we're going to recap it. Now as this starts to expand, you see how it works like a straw. It's going to pull that fluid out. See, it's just filling up. So as this works off of negative suction, it's going to continue to expand and continue to remove all the fluid that's accumulating there. Okay, so wow, this is really filling up fast. So you can imagine what's taking place inside your body. Now, what are some problems that would arise that would make this drain stop working? One of the most common that we'll find is blood clotting. Now, this is just a simulation. It's only cranberry juice. But if this was your blood, our blood starts to become thicker as it starts to pass through this tube. And as it's sitting there, you'll start to find clots. So if this was pinched like this, you'll see it's going to stop running. So what do we do to fix that?
Okay, so what we're going to be doing today is going to be draining the JP drain that comes usually with the tummy tucks. So the first thing you want to do is, I like to use the hand sanitizer because it serves also as a way to clean the actual drain. And I lube up the drain itself first, just so that it provides a little bit of slippery. I don't know. All right, and then I get a little bit more. What I'll do is right at the insertion point, I will hold on using the tip of my finger, the pad of my index finger, and my nail from my thumb. And then with the same technique on the other hand, I will pop this open to not fight against me. And I will hold on as I milk this down. So this is what's called milking the drain. And then you let go at the top, again, hold, and continue to slide down. Let go, and continue. So in the case that there's a clot here towards the actual insertion site, you place a warm cloth right over that insertion site to try to loosen things up a little bit. And I'll just leave that there while I work on the other drain.
Okay, so I'm going to show you guys what I do to make sure that I properly preserve the function of this drain by making sure that there's no clots taking place. Now, it is so imperative before you get started with milking the drain that you recognize this is only held in by a very small stitch, and the rest of this is following behind underneath the incision. So you have to make sure that you grip this very